Hello class, Henrietta here. Today's discussion will be on burns. So, what do we know about burns? There are 4 different degrees of burns, ranging from one as slight as a sunburned area of skin, all the way through to a deep tissue burn, in which soft tissues are burned down to the bone. These degrees in their entirety will be discussed later. There are a variety of types of burns, each with unique causes. For example, thermal burns induced by either severe cold or heat, electrical burns, chemical, radiation, and friction burns. Wake up, wake up! Sleeping will not be tolerated. So for today's class we will be evaluating a scenario where a family is involved in a motor vehicle accident with several injuries sustained, one of which is burns. Because you are nursing students, we will be incorporating holistic practices for treatment, not only for obvious trauma, but also not so obvious trauma such as grief, pain and suffering. Now I would like to share with you Julie's story. Julie's family took a road trip to visit her grandma.
We can't save her.
She's going to need to be intubated and require several skin grafts. This poor girl, and she is only 5 years old.
Where is Mommy?
Julie, I'm sorry Mommy didn't make it. She is gone. She went to heaven.
What do you mean gone? I want Mommy. Is it my fault she is gone? Is she coming back?
So class, what we've learned thus far is that we have a family of 5 who were returning from a family trip when a tragedy occurred. There was a mother, a father, and their 3 children in the car, who were involved in an accident where their car was engulfed in flames. As a result of this accident, the mother was fatally injured, the eldest daughter Julie was severely burned, but the father and the younger children escaped with only minor injuries. Now, at the current juncture, Julie is in the hospital. She is in the J.C. Burn Center in North Carolina, her home state. She is receiving treatment for injuries sustained during the accident where more than 80% of her body was burned. The areas of her body where the injuries were sustained were to the face, neck, left arm, left leg, and back. The extensiveness of these wounds necessitated amputation of her left hand, her left leg below the knee, and her back wounds require extensive skin grafting. Now, how do we calculate the percentage of body surface area in which an individual has sustained injuries from burns?
The rule of 9s, Miss Green.
Yes, and what can we assess with the rule of 9s?
Certain areas of the body have a predetermined number designated for the percentage of body surface area that it makes up. The sum of these numbers, when added together, would comprise 100% of the body's surface area. This number is used amongst healthcare professionals to communicate the amount of the body's surface area that has been affected.
Correct. Earlier in the class I briefly discussed that there is a varying degree of burns. Let's discuss them now. How many classifications of burns are there?
I have the answer to that. There are 4 different degrees of burns. They are 1st, 2nd, 3rd, and 4th degree. 1st degree burns are similar to sunburns. 2nd degree burns, also known as partial thickness burns, cause tissue damage of the epidermis and a portion of the dermis. This can be represented by reddened areas of the skin with blistering. 3rd degree burns, also known as full thickness burns, causes tissue damage of the skin down to the adipose tissue and muscle. And lastly, 4th degree burns, which is a full thickness burn that causes damage through the skin down to the bone tissue.
Any tissue damage or trauma present a certain level of risk for the patient. Why would Julie be at a high risk for developing an infection?
Oh, I know this. The skin is the first line of defense in the immune system. Any interruption in the skin's integrity creates risk for infection. Because she has multiple burn injuries and required amputations, she has several interruptions in skin integrity.
That's correct. Julie also has other contributing factors that increase her risk of infection. Julie required a tracheostomy and was placed on TPN, both of which require sustained openings in the skin. This is a great segue to discuss trach care and the requirements of care for a patient with a tracheostomy. Maintaining an airway is always of utmost importance. Always have emergency equipment available. Some of this includes suction equipment, 2 spare tracheostomy tubes, one of the same size and one of a smaller size, stitch cutter, spare tracheostomy dye, lubrication jelly, bag valve mask device, and a call bell within the patient's or parent's reach. Besides emergency care, tracheostomy tubes require maintenance care. Part of this care includes suctioning the patient as needed, providing stoma care, inspecting the stoma for proper color, ensuring that it isn't bleeding, draining or showing any signs and symptoms of infection, ensuring that the tube fits securely, and assessing the sputum for any foul odor, thickness or discoloration. The next issue of importance for Julie is her TPN, which stands for Total Parenteral Nutrition. TPN is parenteral nutrition given through a central venous catheter, ordered by a doctor or nurse practitioner. The solution is prepared under sterile conditions in the pharmacy. TPN provides all the nutrients to meet the child's caloric needs to supply and maintain a positive nitrogen balance. A person who sustains burns has a higher caloric demand. As with any tissue trauma, the child will require more protein, fluids, and glucose to sustain the body's increased metabolic demands. As with any site where large tubing enters the body, site care and tube care will be required. Some components of this care are tube flushes with isotonic solutions such as normal saline or lactated ringers. Tube filter changes are required, as well as dressing changes. Things to remember: TPN solutions may be refrigerated until they need to be used. Once hung, a single solution of TPN should run for no longer than 24 hours. The infusion is started at a slow rate, and gradually increased to the prescribed order based on the way that the child is tolerating the treatment. Monitor blood glucose levels constantly with this treatment because there is an increased risk for the patient to become hypoglycemic. Our next topic of discussion will be fluid and electrolyte balance. In the period directly after a burn occurs, the patient may become hypokalemic due to mast cell destruction. Hypokalemia later ensues with a fluid shift to meet the metabolic needs of the burned skin tissue. Hyponatremia may also occur as a result of plasma loss. To prevent these complications, most of the fluid volume should be replaced during the first 8 hours following the injury. And finally, class, my last topic to discuss is pain management. With Julie's extensive injuries, she required aggressive pain management. Julie was ordered fentanyl for pain management during dressings. It is important to be aware of why this was ordered. Fentanyl is potent up to 100 times that of morphine, and has rapid onset. Onset is within 1 to 2 minutes. This is ideal for administration prior to wound care. Fentanyl also has a shorter half-life, with duration of analgesia for about 60 minutes. However, monitoring for symptoms of respiratory depression remains priority. And that class is it. I am all done. However, Tarek, Lakona, Kenya, and Rose still have a few things to share with you.